Good morning, everyone. I am Megan Rogers with Indiana SHIP, the State Health Insurance Program, and I am joined with my co-hostess, Susan Spilly, from Indiana. I can't talk, Susan. Indianapolis. Good morning, Susan.
Good morning, Megan. Good morning, everyone.
So this morning we have a very important Facebook Live. All of them are important, but one of the common questions we get is, I'm eligible for Medicare. Do I need to take it? I don't want to take it, or I've been told I have to take it. I don't want to get a penalty for not taking it. So those are some of our top questions we get when people are aging into Medicare. So Susan, I am going to turn it over to you to answer that question for us, or help us determine how we answer that question.
Right. Thanks, Megan. And hey, folks, if you have a question or a comment, Megan is going to be monitoring the chat box, so feel free to just type them in there. And even if you're not watching this live, it's Monday, November 3rd, you can always still type in your questions because Megan and I and a couple of other coworkers do monitor our Facebook page and we will answer your questions. Other ways to get your questions answered are to reach out to us at Indiana SHIP at our call center, 1-800-452-4800. Megan will put that in the chat. So let's get started on to Medicare or not to Medicare. That is the question that many people have, and it's surely a question that we are asked a lot when we are out in the community. But in order to understand your options for Medicare, let's do the super quick review of what Medicare is. Medicare is national health insurance, and it's for people that are 65 years old and older who have paid into the system generally, paid Medicare taxes, or are married to someone who's paid Medicare taxes for 10 years, and some other kinds of people, but generally it's national health insurance. People under 65 can also get Medicare, and those folks are people who receive Social Security disability income for 24 months, and then their Medicare kicks in. A couple of carve-out groups for that too, who might benefit more quickly, but generally those are the kinds of people that we speak with. Now, Medicare has four parts conveniently labeled A, B, C, and D. Part A is the hospital or skilled care part of Medicare, and that's the one that we're paying taxes to receive, so we don't have to pay a monthly premium for that. Part B is the medical part of Medicare, or all the outpatient stuff we get. Now, there is a monthly premium for that, and this year in 2025, that's $185. We're pretty darn sure it will go up next year, but as of me checking my emails in the last 20 minutes, we still haven't been told by the government what those amounts will be. But it will be more than $185, I would bet. Part C are Advantage plans, and this is a way to get your Medicare services in a managed care house. So some of the rules are different and the costs are different than original Medicare A and B, but they sometimes offer additional services that original Medicare doesn't include. Part D is our newest part of Medicare, just been around since 2006, and that's the prescription drug benefit under Medicare. And what's happening right now as we speak, Megan, what's happening with a couple of those parts of Medicare?
All open enrollment.
And what does that have to do with?
You can review your coverage and change your drug coverage or your Advantage plan for next year to a plan that you feel is better suited than what you currently have.
And how do people figure all that out? What are their options?
They can contact us at SHIP and we can help them review. They can do it themselves using Medicare.gov Plan Finder, put in your medication, your zip code, your pharmacies, and you can look at the different drug plans and Advantage plans for your zip code, or you can reach out to an insurance agent.
Right. Those are all great options. And I will say that everybody who's on Medicare right now, you've really got to be looking at your options. just this year, and we've only been doing this since October 15th. I personally, since I was out of town, have only been doing it the last several days, and I have saved people thousands of dollars by helping them look at alternatives to their current coverage. So don't get caught up short in January, stuck on a plan that's going to be super expensive, and doesn't cover your medicines well. So that's our commercial. Okay, let's go next. Okay, so now let's talk about some options for all those different parts of Medicare. Original Medicare is the A and B, the outpatient and inpatient, basically. And um, that does not include the drug plan, but you can also add on the Part D drug plan to that. And most people do add on the Part D drug plan. If you're eligible for Medicare and you do not have any credible coverage, and by credible or creditable, I mean as good or better than the Medicare Part D coverage, then that is when you will incur a late enrollment penalty and you will be restricted during for times of the year when you can sign up for a Part D plan. Even if you don't take medicines, you can still get caught short. When you do finally start taking medicines and you decide you want a Part D plan, if you have not had credible coverage since you were eligible for Medicare at age 65 or disability for 24 months, then you will incur that monthly premium penalty. And that's just wasted money. You can have an Advantage plan, which I said before is a managed care way to get your Medicare benefits and more. And almost all of those do include that Part D benefit within that plan. Or you can have Original Medicare and purchase a supplement, also known as a Medigap plan. And this is an insurance product that you purchase from an insurance company that covers some or almost all of what Medicare leaves off. Now, this does not include drug coverage, so you need to add in that Part D plan. Next. Okay. Now, how to decide between all of those options? First, let's take another look. You got to learn about Medicare. It's not exciting, folks. We get that. We try to make it fun and entertaining when we do presentations on Medicare, but sometimes it can be a little complicated. And oftentimes, what I tell people is to go to multiple presentations, do a little research on Medicare.gov or printed materials from the government, and then just kind of let it roll off and things will stick. And then the more times that you experience presentations or do some reading, more things will stick, and then you'll become more of an expert or at least more aware of all your Medicare options and benefits. So you got to learn about it. You also, if you are still working, you need to know about your employer group plan. Sometimes well, no, always it surprises me when I talk to people who are currently working and they're debating whether to go on Medicare or not. They don't know how much they're paying for their employer group plan. They don't know how much it costs for dependent coverage, and they're really not sure, other than they generally don't like it because they think it costs too much, what it covers and how it works. So it's important that you know about what coverage is available to you. And that could be, maybe you could be a dependent on your spouse's employer group plan. That's always an option. So you need to find out and learn a little about Medicare, your current coverage, or maybe other opportunities for insurance coverage. And then you have to compare those options. So a ship counselor can tell you all about Medicare, how much it costs, what are the deductibles, what are the premiums, what are the rules for use, what are those Advantage plans and how much would those cost? What are those Medigap plans and how much would those cost? What about Part D? How much is that going to cost and will they ever cover my medicines? So a ship counselor can help you gather all your information about Medicare and the related products, but you'll get the other information. And this includes, how your insurance works, what those deductibles are. And I think it's super important for everyone to be aware of the maximum out-of-pocket costs for the year on every insurance plan. Now, the maximum out-of-pocket cost is kind of like a safety net, where no matter how much medical care you consume, you won't spend more than X amount of dollars. Medicare Advantage plans have those maximum out-of-pocket costs. Employer group plans and other insurances always do too. But guess what? Original Medicare A and B does not have a maximum out-of-pocket cost. You can keep paying and paying and paying with no safety net. And that's why almost all Medicare beneficiaries either enroll themselves in an Advantage plan or purchase a Medicare supplement to give themselves that safety net. Now, if you go to certain providers and that's super important to you, you need to make sure that they accept whatever your insurance you're considering, whether it's your employer group plan, whether it's Medicare, or whether it's an Advantage plan. And then you got to learn about the rules. Sometimes there's caveats or certain rules for use, certain limits, certain pre-approvals that are inherent in some plans. And what's important to me might not be important to Megan, but you have to find out what those rules and the little particulars are to see if those are going to impact your decision on what to do. Here's something that you really have to consider, and I think most employers are pretty good about telling folks about this, but if you work for maybe a small one and the HR department, well, that person has 5 other jobs, maybe they're not as aware of this. But this is around healthcare savings accounts, HSA. And this is an IRS rule that prohibits Medicare beneficiaries from contributing to a healthcare savings account. Now, that doesn't mean that your HSA goes away as soon as you're on Medicare. Absolutely not. That's money you've put aside to pay for certain healthcare related expenses. It's your savings account. The deal is that you can't contribute any longer to it, and that's because of those tax advantages. So, another thing that makes this a little quirky is Medicare Part A retroacts 6 months. So when you're signing up for Medicare and you're a regular contributor or your employer is to an HSA, you always need to stop that contribution 6 months before your Medicare starts. Now, of course, this is not before you're eligible for Medicare, but say you're going to retire when you're 70. At age 69 and a half, you need to stop yours and your employer's contributions to your healthcare savings account because that accommodates that 6-month retroactivity for Part A. Super important. Nobody wants to have to pay all that money back. Now, some people get their health insurance through a retiree or a union. And if you do, a ship counselor is not going to be able to tell you about your retiree benefits or your union benefits. So that's some of that information that you're going to have to collect. Sometimes we see that not taking advantage of your retiree or union benefit package that includes health insurance, sometimes that can cause irregularities or problems with your other benefits, pensions, things like that. So it's important that you find out from your employer, your retiree group, your union, about how their insurance that you can get from them, how that works with Medicare. Another thing is, are you covering dependents? I have yet to meet an employer that will allow someone to get off their insurance, go on Medicare, yet insure their dependents. So if you're a person who's eligible for Medicare and you have your employer group plan and you have dependents that need coverage, chances are you're going to say no thank you to Medicare and you're going to continue on with your employer group plan so those dependents can have insurance. And you have to compare employer coverage. Is it better than Medicare? It may or it may not be. And all of those things that we saw on a slide or two ago, you need to understand the deductibles, the co-payments, the rules, the maximum out of pocket, all of those things that you're going to have to do the math for to see what you think might be better, Medicare or your employer group plan or retiree plan. Now, something else that sometimes is a little confusing is your employer coverage primary to Medicare or is it secondary? So if it's primary to Medicare, that means it pays before Medicare. If it pays after Medicare, those folks almost always are better off accepting their Medicare benefits. So that's always something to consider. And your employer will know if it's primary or secondary coverage to Medicare. For folks who have insurance not through an employer or maybe through a governmental source, need to make sure that they understand that if you are on the Healthy Indiana plan, which is a Medicaid insurance plan, you're not allowed to be on that plan when you're eligible for Medicare. Medicaid is the payer source of last resort. So it just stands to reason that Medicaid wants all people who are eligible for Medicare to access those benefits first. So if you're on the Healthy Indiana plan or HIP, you need to make sure that you segue onto Medicare by the date of the first day of the month that you're eligible for Medicare. Kind of similarly, if you are on the marketplace, if you have healthcare.gov insurance, or some people still call it Obamacare, you can technically stay on those plans, but you will have no advanced premium tax credits to help you pay for that. So you would be paying 100% of the premium, and that can be super expensive. Again, I have yet to meet somebody for whom staying on marketplace coverage is better coverage or more financially feasible than going on to Medicare. Also, if you're on any other Medicaid, you need to pick up your Medicare benefits. And for some people, depending on eligibility, you may get Medicare and Medicaid. But Medicare always pays first, and then Medicaid helps people pick up the rest. Speaking of Medicaid and people needing assistance, I did throw in a slide here about some benefits that people might not be aware of. And these are ways, if you are a little strapped financially, if your income is a little on the middle to lower side and you don't have a tremendous amount of assets, you might qualify for these programs. And they can, for some of them, they can help you pay all of your medical. So your Medicare would pay first, and then the Medicare Savings Program at the highest level would pick up the rest of your medical costs. Then we have another program called Extra Help through the Social Security Administration, and that helps bring down your prescription Part D costs. It helps with your premium, the deductible, and it can lower the cost of your prescription medicines. If you think you might qualify for any of these programs, just give us a call at SHIP. We'll do a quick screen, and then if you think you're eligible, we can even help you with the applications over the phone. Here's our information about how to connect with us. There's our telephone number. We have a terrific website, medicare.in.gov. And of course, since you're watching this on Facebook, you're following us on social media. And I'll just give you a heads up for information gathering. There are a lot of sites out there that offer information on Medicare, but there are three trusted sources. Anything with .gov, that's the government. That's who does Medicare. That is a trusted source. MedicareInteractive.org is another good site. Now, not all .org sites are good sources of information, but MedicareInteractive.org is legit. That comes to us from the Medicare Rights Center. And the other one that I think offers some really good information is KFF.org, Kaiser Family Foundation. They do a lot of research and have a lot of great information about lots of topics related to Medicare and Medicaid as well. So any of those sites are good. Watch out for the .coms, the .nets. Chances are they're insurance companies trying to sell you something. So stick to the govs and those two other sites is my recommendation. Megan, what do you have to add to this? What else do you talk to people about when they're trying to decide to Medicare or not to Medicare?
Well, Susan, I can't think of anything else you haven't mentioned. Those are the highlights. One thing I do um, talk to them about or make them start thinking about, not so much on to Medicare or not to Medicare, but when they're trying to decide their options for Advantage versus supplement. And this could still apply when you're trying to decide between employer benefits and Medicare benefits. Think about, are you going to be traveling or not? Um, do you have an HSA that has money in it that you can use for your Medicare premiums, copays, deductibles? Also looking at if you're fairly healthy right now, what are some family conditions? What are family parents, siblings have that would put you at risk down the road? So again, more towards the supplement advantage plan thinking, but it could apply to employer or Medicare on what's going to cover you the most. And I cannot stress enough what you said about coming to your appointment with a SHIP counselor and knowing your current employer benefits. I have met plenty of clients that don't really have a clue for whatever reason. My own husband and brother being some of those individuals as well. So it's just very important because SHIP counselors were going to know the Medicare, and you need to come well versed in your employer, or at the very least, bring your book. Bring your employer insurance book so we can look through it. So, Susan, you covered it very well. Thank you.
You're welcome. And I'll just throw out there that whole decision about whether to go Advantage or supplement plan. We do have a Facebook Live on that should be posted on our YouTube channel. And it's probably still on our Facebook list because it hasn't been more than 30 days. So
No.
give that a quick review if you're at that stage of the game. So what's coming up besides open enrollment?
Well, for Susan and I, we are taking a pause in our Facebook Lives for the rest of November. We are busy during this time till December 7th, helping our community members in Indiana navigate their decisions for fall open enrollment. So we will have some graphics posted throughout the month, but our lives are on hold. Now, we will be back in December, but before we talk about December, Susan and I are also launching a new virtual lunch and learn for Indiana SHIP. So starting in January the 8th, we are going to talk, do you really need Medicare? So it'll probably be a lot of what we're talking about today with some added information. And then February the 12th, we're going to talk about your options for coverage. And then March the 12th, we're going to talk about what is Medicare. So these will be held from 12 to 1 p.m. Eastern. So you can grab your lunch, you can grab a smoothie, you can grab your midday coffee and log into your computer on Facebook, just like you do for our Facebook Lives, and listen to Susan and I talk for an hour over lunch about Medicare. So we're very excited to be launching the new virtual lunch and learns, preparing for your Medicare years. Now back to December, before we get into that, we'll be back after fall open enrollment, December the 10th, on your next steps after open enrollment. What do you need to be watching in your mail for? What do you need to know about January 1st with your new plans or your same plans? And then December 15th, we're going to talk about what is new for Medicare in 2026. And then we're going to wrap up December and 2025 with Advantage Plan open enrollment. So we may be done with fall open enrollment, but we will be moving into another open enrollment for people with Advantage plans. So that will wrap us up for 2025, and we will have additional Facebook Lives in January 2026.
But we do have something really cool happening in December in addition to these Facebook Lives, and that is our new to Medicare evening presentation, which is a live webinar. So it's not going to be on Facebook,
Right.
but it's a live webinar, and you can access that by going to Eventbrite. And if you just type in Indiana SHIP new to Medicare, you can register for that. Of course, there's never any charge for our presentations, and it will be a live webinar. So Medicare and I, Megan and I will be kind of starting from scratch. And it's a little over an hour, but we do take questions live. It will tell you everything from soup to nuts about Medicare. And so if you're thinking about picking up your benefits in 2026, join us and learn about what it is and how it all works.
Yes,
That's
thank you,
on
Susan.
December 19th,
Hold on, I think it's the 18th, but I could be wrong. Let me check. 18th.
18th,
18th
December
at 6
18th
p.m.
at
Eastern.
6 o'clock Eastern Time on Eventbrite. December
Yes.
18th, 6 p.m. Eastern Time.
Perfect. We got a lot coming up, Susan.
We do. So we don't take December off, even though we
Nope.
may want to.
Nope. So look for all of these postings and events in Facebook. Even though the New to Medicare December 18th is not on Facebook, we do have an event created on Facebook. So you can click on that link for Eventbrite and go there to register. Once you register, then you'll get the Zoom link closer to the event. So. All right. Well, Susan, I will see you in December.
Okay.
All right.
Sounds good. Happy open enrollment, everyone.
Happy open enrollment.